that it takes to get some of those signs you're talking about?
Yes. The incubation period is the time that you can be infected but still without symptoms. Can go up to 14 days. But usually they have average periods. Usually by the 5th day you might start having the first symptom. Some people can go up to the 7th, 11th. Some go to the 14th. Some can even go right up to the 24th, even though it's rare. So you can have a period that you are there without symptoms. But the average that I've gotten in most of the patients is 14. That's why the WHO...
That explains why they are talking about 14 days quarantine.
Quarantine, yeah. Yes. So that's WHO has given us a duration 2 to 14 days.
Okay.
So if you think you might have the virus, you can monitor yourself for 2 weeks. If you don't develop any symptoms, you can be, let's say, 80% sure that you don't have the virus, because the incubation period can still be longer than 14 days.
Let me just remind our televiewers that you can send us text messages and WhatsApp messages via the numbers that are on the screen. Please don't call those numbers. Dr. Nguti Rita is here to answer to your questions. Just be very polite and then go straight to the point what you want to know about the coronavirus. I learned from a friend who is a medical doctor in Italy. You know the situation of Italy. We just learned that about 800 people died this 24 hours in Italy, and I talked with him, and an hour ago he's serious. He's in the hospital. I work with. I had to call him, but unfortunately, he just sent me a message to say, "Sorry, Kletus, I will not be able to participate on the program today. Might be Sunday or some other time." He explained to me that there are people who have the virus in them, that they can go without any signs, no illness, nothing, for years, asymptomatic people.
Yeah, they are.
How do you explain that?
There is really no explanation yet for those that are asymptomatic, but the symptoms also range from mild to severe. And you might have mild symptoms and you might think that it's something not serious, and you go about your daily life very well. So there are some people, yes, that can be asymptomatic, even though there are very few of them. Most people have mild symptoms and mild to moderate symptoms, and they're usually a particular population that have severe symptoms.
Who is concerned here? The population, the risk population. We learn also that young people cannot die of coronavirus, but today we learned that a young girl called Julie in France of 16 years of age died of coronavirus. So is it true that only the sinners who contract this disease, this virus, can die of it? Others who are young, no problem. Just get sick and get better.
Well, there's one thing that we should understand. In medicine, there is no cut off. Like, we cannot say that only. Yes, we can say most of the people that die are those that are older. In some...
Doctor, at the very beginning of this crisis, this war, this medical war, the message we got was that only the old were dying of coronavirus from medics like you.
Well, even from the information that you can read online, from the recent information we have up to date, we have the WHO, we have the Center of Disease Control. They still say that most of the people dying, they are old. Even in the US, they had somebody dying, less than 30 years old person dying. And they say the virus is more in people that are older.
So why are the old very vulnerable?
Usually the old, first of all, their immune systems are not strong, and they have been exposed. Most of them have comorbidities.
Yeah.
Most of them have diabetes, hypertension, heart disease, and kidney disease. Most of them have chronic lung disease. They have people that are smokers. They may have developed problems with their lungs and all those things. Those are the factors that make those the older people more at risk, vulnerable.
So is it that the old can't support the what you call ventilators?
Not that
the
they
treatment?
cannot support the ventilators.
Mhm.
There are ventilators. There are people that still die when they are on ventilators. Ventilator is just something that it helps you to breathe.
Artificially.
Yes, artificially. So maybe your lungs is tired, it cannot take in the air that you need. So the ventilator actually moves your breathing, it breathes for you. So I think everybody can support a ventilator. When you need a ventilator, you can support it. But the problem now is just that those other the virus can thrive more when you have your immune system is not strong enough to fight it. Generally, most viruses we depend on our immune systems to fight them. Like even the common cold, when most patients come with catarrh and cough, we might just give you something for the fever. No need to give you antiviral medications. Your immune system is going to fight the infection.
Yeah, but because here in Africa we say, if I have cold, I don't go to the hospital, I don't take any drug, it's okay by me, 2 days is over.
Yes, because your immune system
But
fights it.
flu kills elsewhere.
Now we are seeing.
Yeah,
because coronavirus, COVID-19 is a kind of flu. Yes, and we are seeing that it kills. It goes on to cause pneumonia and it can kill.
Now, in a nutshell, so those who are entering from the country, as the minister said, should be quarantined.
Yes.
Automatically.
Automatically. If you're coming in from a country that is already experiencing community spread of COVID-19, you should be quarantined. You should be kept and monitored for 14 days if you develop symptoms or not. And if you don't develop symptoms, then before you can go in and if we have available test kits, we can test you, but the test kits are limited all over the world. So for those people, we can just quarantine them and observe.
Now, auto quarantine. Is
we
it also necessary?
For
because we just heard this evening that the Minister of Labour, his office wrote a press release saying that he's been quarantined. He's working from home.
Yes.
Gregoire Wona.
You can auto quarantine. Normally we are supposed to auto quarantine in most countries. Like I always give the example of the Prime Minister of Canada. The wife got infected, so he was exposed and he was quarantined with his wife.
This evening we'll learn that Boris Johnson, the British Prime Minister, had tested positive of coronavirus.
Yes.
And he's quarantined.
He's quarantined.
Angela Merkel got in contact with one doctor who contracted the virus.
And he has to be quarantined.
Yeah, automatically.
Yes.
Now, doctor, tell us, women are watching this program for sure. Pregnant women, how dangerous is this virus to them?
From studies that have been done, the few studies, because we don't have like maybe a vast number of patients that we can do an extensive study. From the few studies that have been done, pregnant women instead have milder symptoms, paradoxically, and they doesn't mean that they cannot progress to have severe symptoms, and it doesn't mean that they don't get infected. They can get infected, but there is no special thing about pregnant women. For now, we don't have any evidence to show that there is transmission from the mother to the baby when the baby is still inside the mother's womb. The few newborn babies that have been reported to have COVID-19 have contracted the disease from the mother after they were born, or from a caregiver that had the virus. So there is no evidence to show that the virus can live from the mother to the child when the baby is still inside, or through breast milk. But for preventive measures, I think the mothers, it's recommended that pregnant women should follow the same preventive measures. And even for their antenatal visits, they are supposed to call in. They can still continue with their antenatal visits. They should do their ultrasounds, but it's usually good. Social distances is recommended by the ministry, and it applies to them also. So if they have antenatal visits, there's too much congestion, they can maybe separate and fewer patients come today and then the rest come the following day. So to maintain the social distancing, and but they should still continue their visits.
If we're talking about social distancing, how many meters? We learned at the very beginning that was 1 meter, later on 1.5 meter. Is it 2? Is it 3 now?
The minimum is 1 meter, but if you can stay 2 meter from a person, is best.
Like me and you here is almost 2 meters.
Which is best.
Which is the best. Okay. We have a text message coming from Televiewer who did not sign the message. He said if he gets it, he got it right. Good evening, doctor. Just to know, you said the people from the town of Wuhan ate cold food. Please, did I understand that?
Seafood. Not cold food.
Okay. Seafood. We have another message, please. I want me to explain the price of the fish. Oh, you're missing the point. We're talking about coronavirus. It might be the person wanted to write and ask the price of any medication that will surely cure the coronavirus. Keep sending us your messages. You have the numbers on the screen: 677-513-576, 696-176034 SMS, and or WhatsApp messages. We're waiting on your messages now. Doctor, we talked about the old, the young, the pregnant. Let's talk about protection. Those who are watching us want to really know, because we're talking about quarantine. People should stay at home. That's what you're advising, or the WHO advise. Stay at home. In Cameroon, the authorities are advising people to stay at home. They should not wait. Only when it's necessary, they should be out. But if not necessary, they should stay at home. If I have, I'm asymptomatic, will I not contaminate others at home?
Well, if you have you are infected, you are being quarantined. Quarantine is different from being confined. Now the government is telling people to stay at home, to confine. Yes. So it's now we are at partial confinement. We are not full confinement. Even though it's not really confinement, it's just that avoid crowds. It's better you stay at home.
Yes, but the question still remains. You're asking us to confine. If I'm at home, we are 5 of us at home. You know, we have a problem of housing. We have a 2-room house. We are 6 of us in that house, and 1 person is positive or is asymptomatic. Because I learned from you, expert like you, that asymptomatic patients can still infect others.
Now, if you are asymptomatic, not knowing that you have the virus, that's why even at home we are still supposed to practice the preventive measures. You are still supposed to wash your hands always after touching any surfaces that you know. Frequently touch surfaces. When you touch the surface, you're supposed to wash your hands. If you're at home, you can have access to where to wash your hands. And avoid touching your hands, because the virus, mostly for people that are asymptomatic, they will not be coughing or sneezing. So they'll hardly maybe produce the virus into the air that you can inhale it. But if most of the times they might even take it from their mouth or something and put on surfaces, touching surfaces, and then you can come and touch surfaces and you get infected. So if you are at home, even with people, but you have to wash your hands, you have to avoid touching your mouth and your nostrils. And if you are at home now and you start developing symptoms, that is different. It's advised that you should maybe get a room, a special room that you would quarantine yourself there. And when you want to have contact with maybe people in the house, you should at least put on a mask. For people that have symptoms, they are advised to put on a mask. But if you don't have symptoms, nobody is sick, and you're putting on a mask in the house, you're just wasting the mask.
Yeah, it comes to the question, because we have a fit that we're producing for our Sunday program concerning the wearing of this mask. You see in the streets, I went to Yaoundé the other day. In the car, most of the people in the car had those masks. Yaoundé to Douala is about 5 hours, 5 hours journey, and they had those masks on them. I learned before, because I was interested in this virus from the very beginning. I started in China, the information, and I was learning every day to understand how it works, and if it comes to Cameroon, how can we educate the people correctly on the different attitude they should have concerning the virus. I was like, oh, people having their mask on them 4 5 hours, is that secure?
Generally, after 3 hours, the mask is more or less useless. And if you wear the mask,
It means you can get infected.
You can get infected. Because the mask that we have, we should understand that the mask has two sides. You have the blue side. Most of the masks that we have the blue side and the white side. That's why usually it's advisable for it to be outside, so that it can not absorb secretions from out. Then the side inside, the white side, is absorbs water. That's for somebody that is coughing. If you cough, it can absorb the secretion and keep it there. But it can keep it there for a maximum of 3 hours, after which the orifices become weak and the thing can migrate and enter, and you get you infected. Or if you are infected, you can send out, if you sneeze, the secretion can still pass through and infect another person. So
it's dangerous to
put on the mask
for more than 3 hours, because
yeah.
some even say they use it for 3 days, 4 days, and watch and wear again. Put it on.
That's not advisable. I think that's why some doctors, they will advise that people shouldn't wear masks unless it is necessary, because the mask can become a tool that you will use to infect others and infect yourself. Because if I am not infected and I put on the mask, I'm putting on the mask in case somebody sneezes or coughs around me, then I shouldn't inhale it. Now, if the mask, if the secretions maybe come and they land on the surface of the mask, most of the times people will touch the mask, pull it down, pull it up, all of those maneuver. Normally, once you have your mask on, each time you touch the surface of that mask, you have to wash your hands. Each time. That's why it's very difficult to put on the mask and really follow these etiquette. And even when you wear the mask, even within the 3 hours, if the mask gets moist, it's useless. Once it starts becoming damp, because you see some people, they have sweated and the mask is even dripping water, that they still carry the mask on. It is more or less like you are just walking without anything. It's the same thing.
How many masks should somebody put on a day?
If we want to wear the mask routinely, you will discover that if I want to divide 24 by 3 hours, you should wear 8 masks. That's going to make the mask to get out of stock. We'll no more have masks for people that actually need it. So wear the mask only when it is necessary. If you're going to where maybe there is a lot of crowd, you can put on one mask. You know that's why the government is also encouraging that go out only when it's necessary. You can plan that I am going out for 3 hours to do this thing. You can put on one mask. You go out, do whatever it is that you do. You come back and you dispose of your mask, and you stay at home. You don't need a mask in your house. So averagely, you can use 2 masks a day. But if you want to say you want to go out for the entire day and you are keeping yourself where it's at risk, you might end up using 8 masks, and you will not be able to continue using that mask. We don't know when this pandemic is going to end.
Who is supposed to use this mask?
The mask is recommended according to WHO by people who are infected. That people who are infected should wear the mask. People who have symptoms, who have cough or any flu-like symptoms, even when it's not yet confirmed, they should put on the mask. And people taking care of patients that are infected in the hospital should put on the mask, and healthcare professionals should put on the mask. Those are the people that is recommended by WHO for them to put on the mask.
So those who are watching us should get the point. You should not put on this mask for fantasy's sake.
Yes. Because
some people, they use, because of fear, they put on the mask. And what are the different type of masks we should put on? Is it any type of mask? The construction mask? Where we find people on construction sites in the market, those who are sweeping streets, they put it on. Can we also use those masks?
Well, I've not come across a study that is analyzing all the different masks, because all around the world the mask is going out of stock, and I'm sure that they are trying to develop other ways in which they can have masks. But the construction site mask, they created the mask for a particular purpose. Each of these masks, they have holes there, and those construction masks, when they were putting the mask, they were for large particles that you will not inhale dust. That's different from inhaling a virus. So if they create a mask for dust, that mask can permit viruses to pass through. So that mask will not be appropriate to use for prevention of the virus. And maybe even the wrapper materials that we have, it might not be appropriate. But there are no studies yet that I've come across that is analyzing. But as of now, the WHO recommends the surgical mask that we have, the mask that we have, the blue and the white side, or the N95 mask. The N95 masks are the masks that seal all your face round. Yes. The surgical masks are more that you put on each ear, and there's usually space still there. So those are the masks.
You can only use them for 3 hours.
Yes.
And most of when you say surgical masks, they are those masks you use in the surgery.
Yeah, but they are approved now in this point of pandemic. Even healthcare workers can use them. There are other masks that are reusable, but before reusing the mask, they have to be disinfected. And the masks are supposed to be disinfected by ultraviolet light. That's what can kill this virus. So washing your mask will
doesn't hurt.
Yes.
Even if you use soap.
Even if you use soap, it will not.
Now you're asking people to wash their hands as many times as possible. Their environment, their chairs, their dresses. Each time, they should also wash those dresses. Let's talk about the lifespan of the virus before we come to cleaning your environment. How much time can this virus survive on your hands, on your dresses, on your chairs and stuff?
Well, studies during the lifespan of the virus on surfaces, there are still studies going on about it, but that was published by the New England Journal of Medicine. Said they detected that the virus could even stay in the air for close to 3 hours. Now, even though
somebody sneezes here,
yes,
and then you enter this place, you can contract the virus.
From the study is possible, but even though they said that the titer of the virus, the quantity, let me say so, reduces within that 3 hours, it keeps reducing. So maybe the level to which it can infect also reduces. Now on surfaces they were different, but the least time that we had on surfaces was 8 hours. So the virus can survive on different surfaces. The surface that the virus could survive on for longest are plastics. The virus can survive on plastics for close to 72 hours. So now the problem now comes with gloves, because I see people now wearing
people
gloves.
Are wearing gloves, they are wearing masks, they are
all
on
around
the streets.
They think
they can be carrying this virus along with them.
Along with them. The thing that we say wash your hands is not that if the virus lands on your hands, it can diffuse into your skin and infect you. If it lands on your hands, what we're worried about is that you can take it from your hands to your mouth. You can take it from your hands to your eyes or to your nostrils, and that's when you will get infected. So that's why we're encouraging that you should wash your hands. So even if you wear gloves, the virus can still stay on the gloves and you take it to those parts and you get infected. So whether wearing gloves or not doesn't protect you. It may protect your hands from being touched by the virus, but it doesn't protect you from getting infected.
Because you can still use those gloves to touch your face
and all that. Because people wear the gloves and they touch everything that they do, and they are infecting all those things. Wearing gloves is not going to prevent you from getting the virus. And if you touch somewhere that the virus is there, the virus will get on the gloves. And if you don't wash your hands, if you don't wash off the virus from those gloves, you can still infect yourself with them.
Now, cleaning our environment, doctor, the table you use, your dresses and other stuff. How often should we do that now?
Well, for our homes, we can do it as often as possible. You can clean it even once. It's your
With
home.
what are there some?
Well, there are some recommended products.
Yeah.
Yes, the hydrogen peroxide is one of them.
Okay.
But in some other like the Center of Disease Control talked about using even eau de javel, bleach that we have. Yes, and we can also use you can also use alcohol, but the alcohol, the percentage will be higher than the percentage that is in our normal hand gel.
Hand gel.
Yes, hand gel usually is 60%, but if you want to use alcohol to clean surfaces, it should be from 70% and above.
Can this hand gel kill the virus?
The hand gel can kill the virus on your hands. That's what has been proven to kill the virus on your hands. But drinking the hand gel will not kill the virus.
Will not kill the virus. Now let's talk about treatment. We'll learn in Cameroon that we'll have officially 88 cases. The Minister of Public Health announced it this morning. 66 in Yaoundé, 25 in Douala, 3 cases in Bafoussam, and 2 dead cases. 2 people have been cured. For what? Chloroquine?
Oh, okay. Actually, we are now at 91 cases.
Yes, 91.
Recently, yes, it was announced that we have gone up to 91.
They even said that they've received almost 1,500 calls of people who think they have the disease. So we should be waiting for the number to skyrocket.
Yes. So for now, there is no approved medication by the Food and Drug Association, the FDA. There is no approved medication by the WHO. But
so how do you cure people then?
But there are people that get cured of the virus without necessarily taking medication. Their immune system succeeds in fighting the infection. But now for some countries, the countries have decided to adopt some medications that have been showing some promising in the clinical trials, because clinical trials are going on. They're going on for medications like remdesivir, that's an antiviral medication. They're going on for chloroquine, hydrochloroquine. They're going on for lopinavir, ritonavir. Those are medications that they normally use to treat HIV. They're going on for other medications. But now from the results they are getting promising results. So some countries from that, they decide and they make a declaration in their country. So it has not been published by the WHO. It has not been approved by the WHO that chloroquine treats. That chloroquine is the approved drug to use for patients with COVID-19. But countries, they decide and put their own protocols.
Yeah, like in France, the president signed an order. Permitting the medics, the medical practitioners in the country to use chloroquine, because so there's this doctor, this professor, is a virologist in Marseille, Professor Raoul Didier, who said, and he insisted, and today in France they're using it.
Yes. So they are weighing the options, like what is the advantage of not using it, what are the disadvantages? Because hydrochloroquine and chloroquine, they have serious side effects. They can have side effects.
They have side effects?
Yes, that can even
what are some of the side effects of this chloroquine?
Chloroquine can cause, one of the most known side effects, it can cause retinopathy, problem with your eyes, and can cause blindness. Some can be irreversible.
Can cause cystity.
Yes. Wow. It can affect your blood cells and all that. So it has these side effects, and they have weighed it, and they have decided they have adopted a protocol for their system, and each country is adopting that. So I will not be surprised if we use chloroquine here, and it's something that if the government decides they approve it for our country. But it's not that the WHO has said that.
I think Senegal also is approved it already.
Yes, South Korea also, they approved
in China
it.
they used it.
Yes. So now the main thing is that these medications are not for prevention. The only preventive measure, the only thing that has been proven that can prevent you from getting infected with COVID-19 is washing your hands.
Because there are no vaccines now.
There are no vaccines yet.
So chloroquine is a cure. People should not go and buy and drink and think that they prevent themselves from having disease. Even if you drink chloroquine today, tomorrow, if you get in contact with somebody who is positive, you get the virus.
Yes.
Am I correct?
It's true.
Okay, doctor, we have people trying to call us. I said, just read the crawl on the screen. You have it there. SMS and WhatsApp messages, please. Hello, doctor. Accept greetings from Bonamu Sadi. I am Bruno. How long is COVID-19 virus? Can COVID-19 virus stay in the air? The person did not get the reply of the question I asked you. Before it dies, before it dies, or causing problem.
So, for how long it stays in the air, it also depends on the weather. It depends on the humidity and all that. So, the 3 hours that I talked about was based on a study that was done
in England.
Yes, by the New England Journal of Medicine. So they actually use the SARS-CoV-1 virus and the SARS-CoV-2 virus, and they exposed them. They put them in a confined air in the air, and they did the study. And 3 hours later, there were still some of the particles in the air. So it depends because the virus has, like, the humidity might not be very favorable for the virus.
Okay.
From the previous studies that we had, they said the virus cannot survive more than 27 degrees.
But people, experts debunked it, even in Cameroon.
Yes.
Most of you, you said something yesterday, today you said something else. And it's a perpetual evolution in the studies of this virus.
It's a novel, it's a new virus.
Initially, we heard that from specialists in Europe that Africa is not affected today by this virus because of the heat in Africa. And some medics said, no, when it attacked London, London had 40 degrees.
Yes.
40 degrees in London, and people contracted the virus. So we should be very careful. So people who say, because there are so many messages, confused messages on WhatsApp forums, on the social media, that because we are in the tropics, it's not true that corona can attack a black man. Manu Dibango just died.
Exactly.
Other black people are dying. Yeah.
So that's why we say that in the air, the virus can survive based on the humidity. But on surfaces, the virus can survive longer. Like I said, on plastic, the virus can live for up to 3 days or even more. So if the virus is on a plastic and I touch it there and I put it on my nostrils, I will get infected. I might get infected not because I inhaled the virus, but because I touched my hand somewhere and I got myself infected.
Another message, doctor, good evening to you in the studio. Please, I wish to know whether it is the government who is in charge of the use, leave it, or the treatment being given to those who are infected, or the individuals. I'm Lizzie from Bois de Serge in Douala.
Well, as at now, I have no idea if it's the government paying for the patients that are, I cannot say with certainty that is the government paying for the patients that are hospitalized.
Okay. This doctor is a professional. Congratulations. School went through you. I love the way you explain all this. Even a common man can understand.
Thank you.
Okay. Another message, just a bonsoir. Hi, good evening. The government say to treat one patient it costs 300,000 francs CFA per day. Whereas the WHO now say it's there is no cure yet for the pandemic. So what are they using to treat this virus? Ngua Zachary.
Okay. So
because you are insisting, I said you are really insisting that there is no cure, but you are saying that people some were cured. It's a confused way of communicating.
So the virus I've said it clearly that your immune system can conquer the virus and clear it off your system. And when it's cleared off your system and you test negative, you have been cured. Also, when the patients have this virus, we don't yet have a cure, yes. We don't yet have a medication that we know that, like, it's for malaria. If you have malaria, we give you Quatem. But the thing now is, if the patient has this virus, the patient will have fever, and the patient has to be given medicine for fever. The patient might be dehydrated, and the patient has to be rehydrated with fluids. The patient might have problems breathing, and the patient has to be put on oxygen. So this is what we call supportive care. So we support the patient throughout the care, hoping that the immune system will kick in and fight the virus for us.
Your focal point, we'll come to that, it might be before the end of the program. There are some people watching us in the Southwest region, and the delegate for health in the Southwest region called on the journalists, and we had a talk with them and said there were some cases, suspected cases in the Southwest. There is a televiewer who just sent us a message to know you're better informed. What's the situation of the Southwest region?
From the recent information that I got, the patients that were sent, the tests were actually sent to Yaoundé, and they were tested, and yes, and they were tested negative from what I've gotten. But if the patients were positive, I think it's the place of the ministry to announce. Normally, as a doctor, I'm not supposed to reveal anybody's medical report. It's the government. In the case of a pandemic, it's the government that is supposed to report, especially like the case of a patient that died in La Cantine. The doctor, even if the doctor knew that it was COVID-19, the doctor, based on confidentiality, because we have taken an oath.
Some confused messages.
Yes, we have taken an oath of confidentiality. You cannot say the diagnosis of the patient, even when the patient is dead.
Or negative.
Yes.
No, you don't say that.
But since now we are in a pandemic situation, the government can, and if you see when the government is announcing, they don't say that Monsieur Jacques Famine Dongo are air positive, Monsieur this air positive, Monsieur this air positive. No. They say 88 cases.
92 cases.
92 cases dead. They don't put names there. So all of this, there is a confidentiality also there, and it's not the doctor to review. It's the state. The minister is in charge of.
Hello, good evening. Putting a mask in an order coming from the ministry. So, madam, don't say that we don't have to put a mask. It's a preventive action and not just when you are you can even write in French. There's no problem. You can write in French and then we'll read. She's going to. Vous pouvez aussi écrire en français. Ne pensez pas que c'est uniquement les Camerounais de l'expression anglaise qui doivent écrire à l'émission. Vous pouvez aussi écrire en français. In a nutshell, because the message is not quite, I can't decipher it well, that the Ministry of Health is advising Cameroonians to protect themselves. Is that correct?
I don't
or
think.
He did not get the information well.
He didn't get the information well. The WHO, that's the source of the information, even from the ministry. That's where we get our recommendations.
Okay.
Patients, because if we continue like this, soon we will not have masks. If we continue the indiscriminate use of masks, soon we will not have masks. But the truth is, if you're going somewhere that you know that there is so much crowd there, and somebody can just cough into your face from somewhere you don't know, like in Mashembopi, you can put on your mask. I'm not saying that people shouldn't.
And you said it a while ago that if you are going to a crowded place, you can protect
yourself. But when
mind you don't touch.
Yes. And you should. That's the problem with masks. So if you're putting on the way that Cameroonians are putting on masks, it's not right. You go and you see some people having the mask on their foreheads. You go, some people have it down here on their chin because they have worn it and they are suffocating. You see somebody seated in a car with the screen, with the windscreen up, and the patient is AC, and the person is putting on a mask. Those are some of the indiscriminate use of masks that I'm saying that it's not correct. Yes.
Good evening, Dr. Senator. The person writes, can coronavirus be killed by ironing? Chris Angwangwa from Baden-Baden, Koto, in water.
Well, I've not come across anything that says that coronavirus can be killed by heat. Yes, but washing with the soap and the disinfectant and ironing, all the process can contribute in killing the virus.
Hello, this is Elvis from Limbe. I just wish to ask the doctor where and how can we get the N95 face masks in Cameroon.
Well, I see a lot of people having it all around, and they're putting it on. One thing that I want to recommend is that there are levels of protection. You have level 1 protection. Level 1 protection is when you have exposure to, this is from a handbook that was produced from China. So there's when you are exposed to the public, like you are just generally in a place where that place might be infectious, or you are taking care of a patient. The surgical mask, the normal mask that we have all around with the 2 sides hanging in your ear, is acceptable. You can use that mask. Now, N95 is recommended when you have a suspected case in front of you. As a healthcare professional, when you want to attend to assess this patient, if this patient possibly has COVID-19, then you have to put on the N95 mask. If you don't have access to N and you have access to the surgical mask, you can as well use it.
Another message from a televiewer. Hi, good evening. The government said to treat we read your message already, Ngoa. So if I understand correctly, they treat the symptoms and not the virus.
Well, for the use of chloroquine, when you are using chloroquine to a patient, it's to target the virus, because chloroquine has been shown to deactivate the virus in vitro. In vitro is like not in the body. They remove the virus outside and they put chloroquine reaction, and chloroquine deactivates the virus. So chloroquine, if we're using chloroquine, it targets the virus. But before this chloroquine, remdesivir, lopinavir, ritonavir was discovered, what they did was that they did supportive care. And the supportive care, we are just helping you with your symptoms and hoping that your immune system will kick in and fight the virus.
It means if I was suffering from other diseases, you use ventilators and then you cure those diseases in me so that my immune system gets effective and kills the virus?
For those that, because there are different levels of the patients. The patient, you can have mild symptoms, like maybe just mild fever and cough and catarrh, or you might have moderate symptoms, start having signs of pneumonia, that infection of your lungs, chest pain, and maybe difficulty in breathing, or you can have severe symptoms, because the symptoms can go up to affecting even your heart, can go up to affect your kidneys and all those things. The thing is that if for people that have
go up to creating heart failure,
not really like heart failure, it can go to cause a dysfunction in your heart. Yes. So if your heart already has a problem and it comes and aggravates it, so what it does is that it can aggravate the situation that is already on ground. So for patients now that have, like for the recommendations from maybe from China, the protocol that I saw that China adopted later on to treat the patients, for patients that had mild symptoms, they could just observe them at home and see if they are progressing. And for those people, they might not receive any drug, even paracetamol they might not need, and they just need to eat well.
Some people buying Doliprane in the very beginning of this crisis.
The Doliprane is just to cool down the fever. It's
the pharmacies, everybody was buying Doliprane.
It's just to bring down your fever, and usually, and better, it's not even really very advisable, because when you bring down your fever, now we might not even catch you to see that you are sick, and you might go around, and before we want to discover you're already contaminating others, and before we want to discover you're already having very severe symptoms. So those that have now severe, moderate symptoms, in China they gave maybe chloroquine This remdesivir is a more advanced medication. It's one of the medications that have shown the highest response to this virus. So they usually keep it maybe for severe cases. So the treatment varies for every patient. Every patient is different.
Okay.
Yes.
Quand on trouve le vaccin du virus parce que le pays va mal.
Yes, there are actually studies, like from what I read, the recent up to date, America is already working on a vaccine. There's a vaccine already that is showing promising, but
the president had a meeting with Johnson & Johnson, Pfizer, and most of these pharmaceutical companies, and we learned that 2 laboratories in the United States are working on a vaccine.
But the vaccine cannot come out. Yes.
1 year, 2 years, you have to test first.
Exactly.
Before producing it commercially. Because
the vaccine, you have to be able to test when they want to produce a drug. The drug, in this world we have different races. We have Asians, we have whites, we have Black Americans, we have children, we have pregnant women, we have older people, we have people with diabetes, people with hypertension, people with asthma. They have to test the virus, the vaccine in each of those groups of people and see how they respond. And it's when most of them respond properly to this vaccine before they can now put a fiscal stamp on it and release the vaccine into the community.
Hi, good evening from Gaundere. Please, I would like to know if animals or pets do transmit the virus, and if yes, are animals also affected? Like in Cameroon, animals are affected, because we learned that we have about 500,000 bats in Cameroon.
So, well,
we are afraid the number of the bats we have in Yaoundé.
It's possible.
In Yaoundé, in the Central region.
Yeah, it's very possible. But that's why they'll advise that we should cook the meat that we have to eat very well before consuming.
The minister advised that we should avoid in the very beginning. We should avoid bush meat.
Well, the thing is, usually we can go to the extremes to make people to try to implement them. But if you cook the meat properly, yes, I avoid eating, because I think this thing started when people started eating raw things, things that are undercooked, and they got the virus. But if it's properly cooked, the virus will not survive. Yes.
Okay. Good evening to you in the studio. Please, I wish to ask that if somebody wears the mask not up to 3 hours, for example, I wear it today for 1 hour. That's somebody who's watching the program, hold it just for 1 hour. Can I still wear it for the next day for the same 1 hour and continue like that till it reaches 3 hours? Now that the mask has become more expensive, can we watch, iron it, and wear it again? Please, how can you know that someone is having symptoms around you? So many questions. This one is coming from Lukong Maria.
Okay.
I have my mask, doctor. I wear it for 1 hour. I keep. I take it again another hour. I keep. 3 hours.
No, it's not
dangerous, right?
Yes, it's dangerous. Normally, when you put on your mask, as you're removing your mask, it's going directly into the bin. It shouldn't go into your bag. It shouldn't go on your table. It shouldn't go on any, because once you wear your mask and you walk around, the one side is not infected and the other side is infected until proven otherwise. So when you're removing your mask, even you're not even supposed to touch the middle. You're supposed to remove the mask from the ropes and put it directly, hold it on the ropes and put it directly into the bin. So if you have just 3 hours to use your mask, use it for the 3 hours maximum.
3 hours is maximum.
It's the maximum on you.
Even if you put the mask on for 30 minutes and you remove, you throw.
Yes. So it's better that you remove. And maybe if you put on the mask and you pull it down, the only thing is just that if you touch the mask, do your hand wash. Because now we need to adjust. Normally, if you remove, you're done with your mask, you throw it. But some people might just, maybe they're suffocating, they just want to breathe a bit. So you can pull it down, but once you touch it, you should sanitize your hands. No, but we should avoid really putting it on our face, on our forehead, on our necks. It really does not make
Good evening,
sense.
doctor. Can someone can concentrated salt water be used as a sanitizer? If so, how does it affect the virus? Secondly, why can the government not create or improvise special hospitals for confirmed cases in Douala and Yaoundé as it was done in China and currently USA, apart from Douala?
Okay.
Now let's begin with the first part of
question.
It's concentrated salt they use as sanitizer.
It has not been shown to kill the virus. Even the hand sanitizer, it's not every hand sanitizer that kills the virus. The hand sanitizer
I even
has
learned that
to be
your hands are supposed to be clean before using the hand sanitizer.
exactly.
Don't have a dirty hand.
If you want a dirty hand, you have to wash it first. Yes.
With tap water.
With tap water. With running water.
Running water, sorry.
Yeah, and
with
soap.
running water and soap.
For at least 20 seconds.
There's a problem with having water. If you don't have running water, you can also use can you use a cup? So can someone help you use a cup? You wash and then
the only thing is
yourself.
don't wash your hands. Carry water from the basin and wash. Like what we do, you go when they serve you food, they give you water inside. They normally supposed to pour the water and you wash. It must not be from a tap directly. Yes. And salt, the alcohol has to be at least 60%. So salt doesn't kill the virus.
Doesn't kill the virus. We have other messages. Good evening, doctor. Clarify my wife watching you, madam. What position can be employed for sex? My wife is getting it all wrong, bearing me from performing my matrimonial duties. That comes to another serious question here. Couples, with the advent of this coronavirus, social distancing, even at home, you advise if you have some symptoms, some signs of coronavirus, quarantine yourself in a room. People should not enter that room. You should be the only person using the room. Is it not creating problems amongst couples now? Can we kiss easily? Can we make love?
If somebody is infected, the person is quarantined, it's better to avoid contact with the person. And even if you have to have contact with the person, you should wear a mask. But if somebody is just being confined, if you people are just in your house, protecting yourself from getting infected by not going outside, that's different. Two of you are not infected. You can stay at home and do all the things that you have to do. So
they can have sex.
Yes, if I'm not infected, you are not infected. Where will infection come from? It's not as if it's sexually transmitted or the virus will just, once you people come into contact, the virus develops. No, it's if somebody has the virus that if you come close to me. So the social distancing usually is for somebody that you don't know. Yes, somebody you go outside, I don't know you, I don't know where you've been, I don't know who you have been with. But if you are my wife in the house, I know what happened. And if you, it's also advised as you leave from outside, as you are entering the house, the first thing, wash your hands.
Move your dress.
Yes, wash your hands.
Wash in your body.
If you can, but the main thing is the main thing is to wash your hands.
Good evening, doctor. I am so happy to follow your presentation. Is COVID-19 treatment free in Cameroon, and which breed corner centers if it's the case? Thanks, Chair Chachin.
Well, for now, the ministry has said that if you have symptoms, you call the toll-free number 1510. When you call the number, they will tell you how to manage your symptoms. They will ask you questions, find out what is happening. And if you are serious, if it's a high suspicion, they might take you in and they test you. And if they test you now and you are positive, you have to be quarantined. They will monitor your symptoms and see which treatment will best be fit for you, and they will give you the treatment. About if it's free or not,
you don't know. This one is coming from Yaoundé, Dr. Nguti Rita, health and safety expert. Good evening, doctor. My worry is about the poor people, less privileged, infected with COVID-19. Will they be taken care of if they don't have the money to pay the treatment? I love the way you explain things to the listeners, to the televiewers. The name is Kenya Alex, watching in Yaoundé.
That's a very good question, and that's something I've also thought about. And we are hoping that I think the government will do their part. they are trying to do their part. So if the poor people in the villages are sick, I think they will not underlook those people, because this virus, yes, this virus is something that if you underlook one person, that person might contaminate around until it comes back and meets you. So I think that in the hospital,
it has nothing to do with the privilege and less privilege.
And less privilege. We are
because
just
we
trying.
Just talked of Boris Johnson, who is the Prime Minister of England. He's like the head of state of England. He got infected. The wife of the Prime Minister of Spain got infected. The Minister of Culture in France got infected. The Vice Minister of Health in Iran got infected. So many other people
have been infected.
The Minister of Economy in the DRC got infected. Infected her husband and the Chief of Staff.
So it's just
Manu Dibango got affected.
Exactly.
He died of it.
So if anybody is infected, we are just trying to treat you so that you will not be a threat.
High spotlight, just to ask if the hand sanitizers that we are using now every day will not later cause another effect. Handle virus. My fingers are already twisting. Jacob from Yaoundé, watching using the sanitizers day in, day out.
I would say we as health professionals, we have been using this sanitizer for ages. We have been using alcohol to disinfect our hands for ages, and our hands are doing just fine. So I don't think that the virus, the sanitizer is going to affect your hands.
Bonsoir, docteur. C'est Idriss Kamini. J'aime votre façon de parler, mais je ne sais pas si vraiment le douleur, comme disaient les gants, sont vraiment une prévention pour le Covid-19, ou c'est juste des paroles en l'air?
The gun?
Yeah.
The gloves?
The gloves, yeah.
That is it a preventive?
Yeah.
No, the gloves are not necessary at all. If you're walking around, you don't need gloves. The only place where we use gloves is when we are taking care of the patients in the hospital, and that we have to put on the gloves before, because we have to put on the gloves.
But those who are in the banks, who are touching money, because you just said a while ago that they survive on surfaces. Money also.
Yes.
Can they not survive on money?
Well, the thing is, most of these protective measures, they usually give us a false sense of protection. You feel like, as I put on these gloves, I'm fine.
Okay.
I'm good. So if people working in the bank think that maybe they're touching a lot of money and they might not have all the time to be sanitizing their hands, as they put on the gloves, they should ensure that it doesn't touch their face. And sometimes some people, it's just a reflex. Your hands just goes to your face. So they have to ensure that their hands doesn't go to their face. And they have to also be careful when they are removing the mask, the gloves. If you are removing and this part that is still having the glove touches your skin, if the virus was there, it's getting on your skin. And then, so you have to remove it.
And water
so
to watch.
yes, so the problem with
boils
this,
down to watching your hands.
Yes, the problem with these things is that there are just too many rules. That it's better you keep your hands like this and know that if my hand has touched anything, I should clean it first before I continue what I'm doing.
Dr. Rita, sorry to ask this question. Can alcohol be useful to heal COVID-19? Because some people say if they drink a lot of alcohol, it will help them.
No. Alcohol is to kill the viruses.
I mean, like the drinks.
Yeah.
In the bars.
It's used
alcoholic drinks.
Yeah, I know.
Yeah.
The alcohol that we are talking about is to kill the virus on your hands. And the alcohol
that other alcohol can kill the virus.
It's a different type of alcohol. The alcohol in hand sanitizers is different from the alcohol that we drink in beer.
So drinking beer will
and the
never
percentage is too low. You cannot even use beer to sanitize your hands. You will not kill the virus if it's on your hands.
I am called Dromi Kelly from Yaoundé. Now that they have closed schools, the sound closed the markets. You're asking, the closed schools, the markets are open. In Douala, we learned today that the mayor of the second district of Douala closed the market. A good decision?
It's a good decision, and I think
Are we
confinement.
not going slowly to total confinement?
We are going slowly.
Because we're talking
slowly.
about 190 now. Very soon, the minister yesterday warned that about 1,500 people caught and they are complaining that they have the symptoms. People in Yaoundé, prostitutes were confined by the mayor of Yaoundé. In Douala, mayors are reacting, closing down some markets. Very soon we might copy the South African example.
Yes, the thing is the Cameroon, it's difficult for our economy to adjust, for the people to adjust to total confinement. So I think that progressive partial confinement will help us. Like if we start, like I was really impressed with the fact that the mayor had to close down some markets, but he left some other markets. You could go there, but progressively we'll be going. If they do total confinement in Cameroon, it might be very catastrophic and it might not be effective. But if we do progressive partial confinement and progressively preparing the people, and the people adjust to the situation slowly, we can get to the point now that we can do total confinement and
don't do overcharging, overloading
in the cars
and the bikes. You respect that. Social distancing, you respect. Please, doctor, if I touch a contaminated object after 2 or 3 hours or 3 minutes of washing my hands, can I be contaminated? Number 2, is every cough, catarrh and fever a sign of COVID-19?
The first thing is, if every surface is contaminated until proven otherwise,
if I touch, I should wash immediately. Wow.
That's why we also bring now the hand sanitizers inside, because you cannot be washing your hands. You might not have access to water everywhere. So it's just to have your hand sanitizer. If you open the door, use the doorknob, even though it's advised to open the door with your shoulders or to use this part of your hands. You want to put off the lights, you don't use your finger, because even the elevator, that's where people can touch and all those things. You should avoid all those things. So if you do that, maybe by mistake you open the door with your hands, or you touch a surface that is frequently touched by people, you sanitize your hands immediately. And the second question, every cough.
The cough. Catarrh, sign.
Not every cough. Yeah, but now that we are experiencing a pandemic, when you have a patient having fever, cough, catarrh, we should always try to exclude that it's not COVID. Yes, but it doesn't exclude.
Not get panic-stricken.
You should not get panic-stricken, but because the cough could still just be a common cold, it could still just be allergies. It could, because there are people, their allergies act up, they start sneezing, cold. Yes, and all those things. Or you can sleep and you are exposed to your fan, and you can get up and start sneezing. You should not panic. You should always monitor your symptoms and see if it is progressing. If you start having fever, it's getting worse, your chest start paining, you start having you should be worried by then. And you should not panic still. You should call in the hospital. Usually preferable, yes, it's preferable to stay at home and call, so that they should be prepared to receive you, than that you just go into the hospital, because as you are going, you are entering a taxi, you are exposing people. If you're if you have COVID-19, you have exposed the people that the driver that carried you. When you go to the hospital, you are waiting in line, you are exposing the people you are waiting in line to. And when you enter now, before the doctor now wants to assess you to see that you probably have this, you may have already infected a lot of people. So that's why the recommendation comes in that stay at home. When you have these symptoms, call and say that this is what's happening, and they will give you directions on what to do.
Hello, doctor. Good evening. I enjoy your program, but how can you explain the fact that our schools are closed and public gathering discouraged because of the virus, but yet still too common to see Cameroons rubbing shoulders in overcrowded markets? Pius is writing from Bamenda.
That's the problem.
Markets are overcrowded. People are there.
That's the problem we are facing. And it comes back to us. Cameroonians should understand that the government will do their part. They might not do as much as they want the government to do. It doesn't cancel the fact that we have our parts to play. If they are saying that social distancing, endeavor, try. Like even when you go to a place, you should consciously not go and sit and pack up in it. If there is a line to go somewhere, you must not come and park in the line. You can come and you stand, you can respect the social. So we should personally take the responsibility to implement these preventive measures. Even if the government gives everybody 1 million, brings water and puts in your house, and you will still have to wash your hands. You will still have to practice cough etiquette. You will still have to not cough into the air, cough into your shoulders, not sneeze into the air.
Like this, or sneezing like that.
And like this. But you still have people that will just cough into the air like that. Or somebody that is coughing and maybe you tell the person to cough properly and the person becomes angry. All these situations are situations that we face, and it's Cameroonians. It's not the government. It's not the Minister of Public Health. It's you that is not implementing something that is doable. They have not asked us to buy anything. We just asked you to wash your hands. Use savon even. Wash your hands and you will be clean. Don't touch your face. Nobody will come and pull your hand and touch your face. It's you that will do it. Don't touch your face. When you want to cough, do this. When you have these symptoms, do that. They've told you what to do. If you do all those things and then yet the infection is still spreading, that's when you can now sit and say that, but we have done all of it, and then why is it that this is not happening?
Yeah, Doctor, I think we'll just get to read one more or two more messages from our televiewers. And also the public toilets. It's advisable to use the same toilet issue with people being affected or not in public toilets. You have the toilet tissues.
For toilet tissues,
because you talked of surfaces.
Yes.
It's also a surface.
But if the person is infected,
you touch your face and then you use it.
If you use it and you clean yourself, you should wash your hands after.
Okay.
Yes.
Another message. LTM spotlight. Let's talk about the watching why elbow greeting with the elbow, cough sneezing to the elbow. Why should he sneeze like this, cough like this, and then you greet like that? Because you're advising people, if you really want to touch, don't use the elbows.
Well, we don't advise even that you should touch. You can do namaste. Yeah, namaste is the best one.
Okay.
Like you greet like this. And coughing into your elbow is because the reason why we said 1 meter distance is if in case I just sneeze into the air, it said the virus, it stays in the air. It cannot travel more than 1 meter and meet you there. So that's why we said, but now 1 meter. But now, if we don't want the virus to be in the air, we shouldn't sneeze into the air. Sneeze into your shoulders and the virus will stay here. Yes, it will not go on to touch other people. And usually
it doesn't migrate. It doesn't leave your dress to your body except you touch your face.
Yes, it stays where it has been put. That's where it stays. So it will not start walking on your body. No. The only way that the virus migrates is when it attaches on the proteins in the lungs. Then the proteins now helps it to enter into the cells in the lungs. Then when it starts multiplying.
Good evening, Doctor. Please, we should know through exchange in the market, what can we do to avoid contamination? Please, Kevin O'Neill writing from Douala.
For that one, this is my own personal advice, like for what I do. Usually if I go, like maybe if I take a bike to go home and I have to pay the person and the person gives me change, what I do is I take the money and I put it directly into my bag and I sanitize my hands.
Okay.
Yes.
Another message. Good evening, Doctor. Please, I wish to ask if pregnant women tested positive hereby endangered. I think we answered that question. The replay of this program is tomorrow 5 p.m. so you can still watch and get some of the answers that Dr. Rita Nguti proposed on the program. What if your dry neck and it's pain a result from the virus? From Douala, if you have a dry neck, it's paining, is it?
If you have a sore throat is one of the symptoms, but it doesn't mean that you have the virus.
It doesn't mean you have the virus. Now,
yes.
we just, people were saying in the very beginning that if you drink water regularly, even if you have the virus in your neck, it goes to your stomach and then the enzymes in your stomach
kills the virus.
the virus. Is that correct?
That sounds very scientific, but it's not correct. That's not been proven to kill the virus.
Thank you so very much, Dr. Nguti Rita, for answering present on this program this day to come and enlighten the public on La Télévision du Monde and on the program Spotlight.
Thank you, sir.
We take the appointment for some other time. Technically, we're assisted today by Idris. At the broadcasting end, we had Smith, and this program was directed by Mr. Romeo Nemango. From us to you, it's bye-bye.
Okay. You got my name.